Vitamin D is often called the sunshine vitamin because the body can synthesize it through sunlight exposure. However, its significance extends far beyond its nickname. This essential nutrient plays a critical role in maintaining healthy bones, supporting immune function, regulating mood, and even reducing the risk of chronic diseases. Despite its importance, many people around the world struggle with vitamin D deficiency, which can lead to serious health consequences. In this video, we will explore the role of vitamin D, how it benefits various aspects of health, sources of this nutrient, and ways to prevent deficiency. What is vitamin D? Vitamin D is a fat-soluble vitamin that the body can produce when the skin is exposed to sunlight, specifically ultraviolet B, UVB rays. It also functions as a prohormone, influencing multiple bodily systems. Vitamin D exists in two main forms. Vitamin D2, ergocalciferol, found in plant-based foods and supplements, and vitamin D3, cholecalciferol, which is produced in the skin upon sun exposure and found in animal-based foods. Both forms must be converted into their active form by the liver and kidneys to function effectively in the body. The active form, known as calcitriol, plays a vital role in regulating calcium and phosphate levels, essential for many physiological processes. 1. Bone health and calcium regulation. One of the primary roles of vitamin D is to regulate calcium and phosphate levels in the body. Without sufficient vitamin D, the body cannot absorb calcium effectively from the diet, leading to weaker bones. Prolonged deficiency can result in conditions such as rickets, a childhood disorder that causes bone deformities, osteomalacia, the softening of bones in adults, and osteoporosis, which makes bones fragile and increases the risk of fractures. By maintaining healthy calcium levels, vitamin D helps prevent these conditions and supports overall bone health. 2. Immune system support. Vitamin D plays a crucial role in modulating immune function. It helps activate immune cells that protect against infections and reduces chronic inflammation. Research has linked low levels of vitamin D to an increased risk of respiratory infections, such as colds, flu, and even COVID-19. Ensuring adequate vitamin D levels helps the immune system function efficiently, reducing susceptibility to illness. 3. Mood regulation and mental health. Vitamin D also affects brain function and mood regulation. Low vitamin D levels have been associated with depression, anxiety, and seasonal affective disorder, SAD. Studies suggest that vitamin D can influence the production of neurotransmitters such as serotonin, which impacts mood and emotional well-being. Regular sun exposure, along with dietary intake, can help maintain mental health and reduce the risk of mood disorders. 4. Prevention of chronic diseases. There is growing evidence that adequate vitamin D levels may reduce the risk of various chronic diseases. For instance, vitamin D can help regulate blood pressure and prevent cardiovascular disease. Additionally, studies suggest a link between vitamin D deficiency and impaired insulin sensitivity, which is relevant for type 2 diabetes. Some research also indicates that vitamin D may reduce the risk of developing certain cancers, such as colon, breast, and prostate cancer, by inhibiting abnormal cell growth. Furthermore, maintaining adequate vitamin D levels can lower the risk of autoimmune conditions like multiple sclerosis and rheumatoid arthritis by modulating immune function. Sources of vitamin D. There are 3 primary ways to obtain vitamin D. 1. Sunlight exposure. When UVB rays from the sun hit the skin, they stimulate the production of vitamin D3. However, several factors influence the body's ability to synthesize vitamin D through sunlight. Geographical location. People living in higher latitudes receive less UVB exposure, especially during winter months. Skin color. Individuals with darker skin have more melanin, which reduces the skin's ability to produce vitamin D. Age. As people age, their skin becomes less efficient at synthesizing vitamin D. Use of sunscreen and clothing. While these protect against sun damage, They can also block vitamin D production. 2. Dietary sources. Although sunlight is the primary source, certain foods provide small amounts of vitamin D, including fatty fish, salmon, mackerel, tuna, and sardines. Cod liver oil, a rich source of vitamin D3. Egg yolks contain moderate amounts of vitamin D. Fortified foods, milk, cereals, and plant-based alternatives are often fortified with vitamin D. 3. Supplements. For individuals who struggle to get enough vitamin D through sunlight and diet, supplements can be an effective option. Vitamin D3 supplements are generally more effective than D2 in raising blood levels. Healthcare providers often recommend supplements, particularly for elderly adults, pregnant and breastfeeding women, people with limited sun exposure, individuals with certain medical conditions affecting nutrient absorption. Vitamin D deficiency. Causes, symptoms, and risks. Causes of deficiency. Vitamin D deficiency is common worldwide, and several factors contribute to it. Limited sun exposure due to lifestyle or climate.
Poor diet lacking in vitamin D-rich foods.
Medical conditions such as celiac disease or Crohn's disease, which impair absorption. Obesity, which reduces vitamin D availability since it gets trapped in fat cells. Symptoms of deficiency. The symptoms of vitamin D deficiency can be subtle and easily overlooked, but common signs include fatigue and muscle weakness, bone pain and joint discomfort, frequent infections, mood changes, including depression, long-term risks of deficiency. Chronic vitamin D deficiency can lead to severe health problems, including osteoporosis and fractures, increased risk of cardiovascular diseases, compromised immune function, worsened mental health issues, such as depression. How much vitamin D do you need? The amount of vitamin D a person needs varies based on age, health status, and lifestyle. The recommended daily allowances, RDA, are infants, 0-12 months, 400 IU, 10 mcg, children and adults, 1 to 70 years, 600 IU, 15 mcg, adults over 70 years, 800 IU, 20 mcg, pregnant and breastfeeding women, 600 IU, 15 mcg. Higher doses may be needed for people with deficiencies or specific health conditions, but supplementation should always be guided by a healthcare provider to avoid toxicity. The risks of too much vitamin D. While rare, excessive vitamin D intake can lead to toxicity. Since it is fat-soluble, the body stores excess amounts, which can result in hypercalcemia, high blood calcium levels, causing nausea, vomiting, and kidney problems. Heart issues due to calcium deposits in blood vessels. To prevent toxicity, it is essential to follow dosage recommendations and consult a healthcare provider before taking high-dose supplements. Vitamin D plays a vital role in promoting bone health, supporting immune function, regulating mood, and preventing chronic diseases. However, many people do not get enough of this essential nutrient due to lifestyle factors, limited sun exposure, or dietary choices. To maintain optimal health, it is crucial to strike a balance between sun exposure, dietary intake, and supplementation when necessary.